Have you ever felt your heart suddenly start racing, your chest feel tight, your thoughts start spiraling, and you can't seem to switch your brain off? Maybe you've told yourself, I'm overreacting. But anxiety isn't simply worrying too much. It's your brain and body responding to a perceived threat, sometimes even when there is no immediate danger. So what actually happens when anxiety takes over? Let's break it down. What actually is anxiety? Anxiety is a normal human response. Your brain is designed to notice possible danger and prepare your body to respond. The problem isn't necessarily anxiety itself. Anxiety becomes a bigger problem when the fear or worry becomes persistent, overwhelming, or starts interfering with everyday life. Anxiety disorders can affect work, relationships, school, and ordinary daily activities. Think of anxiety as your body's alarm system. When that alarm detects a possible threat, your body prepares for action. Your heart may beat faster. You may breathe more quickly. You may sweat, shake, or feel tense. Your stomach can even react. These physical reactions can feel frightening, but they're part of the body's stress response. The symptoms people don't always talk about. Anxiety isn't just the feeling of being nervous. It can affect your body, thoughts, and behavior. Physically, you might experience a racing or noticeable heartbeat, dizziness or lightheadedness, sweating, shaking, headaches, breathlessness, nausea or stomach problems, and sometimes even chest discomfort. Mentally, you might constantly worry about the future. You might struggle to relax. You may have difficulty concentrating or sleeping. You may constantly imagine the worst possible outcome. And behaviorally, anxiety can cause people to avoid places or situations that make them uncomfortable. And that's where something important happens. Anxiety can create a cycle. You feel anxious. You become frightened by the feeling. You start worrying about the feeling itself. And that can make the anxiety even stronger. What is a panic attack? Now let's talk about panic attacks. A panic attack is a sudden period of intense fear or discomfort. It can happen very quickly and sometimes without an obvious trigger. Your heart may race. You might feel dizzy or lightheaded. You could sweat, shake, or feel short of breath. Some people experience tingling, nausea, chest discomfort, or a feeling that something terrible is about to happen. And here's something important. A panic attack can feel incredibly dangerous without actually being life-threatening itself. But because symptoms such as chest pain or difficulty breathing can also occur with medical conditions, new or severe symptoms shouldn't simply be assumed to be anxiety. If you're unsure, seek medical advice. Why does anxiety keep coming back? Here's where anxiety can become a cycle. Imagine you experience a panic attack in a supermarket. The next time you enter that supermarket, you remember what happened. Your brain thinks, what if it happens again? Your body becomes tense. You notice your heartbeat. You become frightened. And suddenly, the physical sensations themselves become the thing you're afraid of. You might start avoiding that supermarket. Then another place. And eventually, your world can become smaller and smaller. This is one reason professional treatment can be so important when anxiety begins interfering with everyday life. What can actually help? So what can you do? First, don't try to fix everything at once. Start small. Number 1. Slow your breathing. During intense anxiety or panic, slow, controlled breathing can help you regain a sense of control. Number 2. Ground yourself. Bring your attention back to what is happening around you instead of getting lost in frightening thoughts. Notice what you can see, what you can hear, what you can physically feel. Number 3. Move your body. Regular physical activity such as walking, swimming, running, or yoga can help with anxiety and relaxation. Number 4. Talk to someone. You don't have to explain everything perfectly. Sometimes simply telling someone, I'm struggling with anxiety, is the first step. And remember, healthy habits can support mental health, but they aren't a replacement for professional treatment when you need it. When should you get professional help? You don't have to wait until you're completely overwhelmed before asking for help. Consider speaking to a doctor or qualified mental health professional if anxiety is becoming difficult to manage, isn't improving with the things you're trying, or is interfering with your everyday life, work, relationships, or sleep. Treatment can include talking therapies such as cognitive behavioral therapy, medication, or a combination depending on the person's situation. And seeking help doesn't mean you're weak. It means you're taking your well-being seriously. Anxiety may make you feel like you're losing control. But understanding what's happening inside your mind and body can be the beginning of taking that control back. You are not your anxious thoughts. And you don't have to figure everything out alone. If you found this helpful, subscribe to the Mindspulse for more videos about psychology, the brain, well-being, and understanding yourself. Until next time, take care of your mind.